Good afternoon, everyone. Thank you for being here for our update today. Why don't we go over some data, clarify some topics we've been talking about, and certainly take some questions. Uh, Look at another tough day in the community. We've lost 5 neighbors since we were together yesterday in our fight with COVID-19. 3 individuals were in the hospital, and 2 individuals died in nursing homes. And I'm just so sorry to all of their families. And, let's think about them. Let's remember them. Let's remember everybody we've lost in this process, not just to COVID-19, but everybody we've lost in the community where their families have been unable to grieve together. When we look at the data with our neighbors in the hospital, I have that data. I don't have data on who's in the nursing home, except certainly one of our neighbors we lost, their family members reached out to me, and so I spoke to them, but those will be private conversations. One was a female in her 50s of another race. One was a Caucasian woman in her 60s. She did have underlying medical conditions. One was an African-American man in his 60s with underlying medical conditions. We have now lost 44 individuals related to hospitalization, and we now have lost 21 individuals in nursing homes. This information is coming off of reporting on the New York State Department of Health's website. To our point, our information yesterday about the increased number in deaths is accurate, unfortunately. So as a community, we've now lost 65 people to COVID-19. Related to testing, we have now done 15,392 tests. We've had 15,226 tests that have been returned. 828 tests were returned yesterday. Since yesterday, just a tremendous amount of tests. As we know, we have tests. We're going to find positives. So we'll get into that in a minute. And here we are. There have been 1,286 positive cases, and we've had 13,940 negative tests. We have 166 pending tests. And since yesterday's reporting, we have sent 646 tests. So the labs are in pretty good shape now, getting us back pretty quick data. That's really important as we isolate and track with our tracers, and then we certainly quarantine. So 8.4% of the results we received are positive. In our numbers now are some state negatives related to nursing homes. Not all, but we did receive some data. So those are now included in our numbers. In the coming weeks, certainly we're doing proactive tests today and every day moving forward to meet the new mandates that we need to meet as a community. And so we're very busy with testing. We'll continue to have large numbers. We'll bring on new labs as we need to make sure that we aren't slowing down turn times. Right now, Quest doing a very nice job for us with turn times, and each hospital has their own relationships with the community. Some labs will clearly have more capacity to do more with us, so we're working with those labs as we are going to. The key, you can't do 14,000 tests a month and then have turn times 5, 6, 7 days. That defeats the purpose of proactive testing and your tracers. So we continue to build up that infrastructure, and we're pretty comfortable where that is. 52 new cases. That was the number of new cases today. We'll get into a breakout of of what that represents in a minute. But again, if you look at 52 divided by 828, the actual percentage is less than 8%. I think it's like 6.2, 6.3%. And why would that be less? It's because we're doing proactive testing now. We've gone through the buildings that we knew the virus was in, related to assisted living facilities and independent living facilities. Now we're going into these facilities with high density and our seniors, where we don't know the virus being there, so the percentages of positives will be less. Why are we doing that? Because we see what this virus does to our seniors. And it's about identifying this and saving life. So looking at hospitalizations, again, we're on top of this drop-off situation with nursing homes now, but some of these increases in numbers are related to that yesterday. So we expect these to come off our totals. But we have 64 individuals in the hospital now, up 11% of our cases. There was asymptomatic or light symptom COVID residents who were at nursing homes that were dropped off yesterday while we were reporting. Those weren't in our numbers. So some of these are going to go down. Why are they going down is because we have coordinated now, and we have a facility, a large facility that is going to take more COVID positive residents into that facility from some of these smaller facilities. And so we're organizing capacity, and we're going to work through that network again. So I'm very thankful of the way that all of our nursing homes are working together at this point. Critical condition, we have 13 individuals. That's down from one yesterday. And so 2% of our active cases. When we look at 152 people throughout this process have gone into the hospital and have been released from the hospital. That's up 4 from yesterday. So what we're seeing is people are going into the hospital and they're getting better. The demographics in our community now of who has COVID have changed drastically. People who are in nursing homes with medical conditions. And so there are going to be more hospitalizations because these folks had medical conditions before COVID-19. Now you're going to have more. So every day we got people that are getting better, but because of who has been impacted by this virus now, for this period of time, we're going to see more people going to the hospital too. So that's probably going to be a break-even proposition almost every day. So related to the positive cases, 1,286 positive cases, up 52. Again, the percentage dropped off from the testing pretty remarkably. I think it's around between 6 and 6.5. We're monitoring 561 active cases now, up 29. 681 people have recovered, good, up 20. That's a good recovery day. We've had 2 solid recovery days in a row. Very good news. 188 individuals in our positive cases are contacts. That's up 13 from yesterday. So these were individuals that were in a quarantine already, limited risk, but again, impacts our numbers. Now we have to go through, get these people better. We kind of knew this would happen. We've always known this would happen. 20 of our new cases are affiliated with senior living facilities. Most of these are coming from nursing homes. So we now have, out of the 52, 33 are contacts or affiliations, 19 are community spread. So our 7-day rolling average on community spread is at 19. Not our best week, certainly stabilized some of the better weeks we've had. But remember the incubation period on this virus, 3 to 5 days for it to usually show itself. And so certainly if folks aren't practicing physical distancing, you have a nice day. You could see more demand for testing 3 to 5 days later. And 1 day's lapse in the community could lead to quite a few community spread cases. So that's important to remember that. We have 1,330 people in a quarantine or isolation. That number is not going to move as fast because out of our active cases, if you're a senior, 14 days in isolation no matter what. Those rules have changed midstream in this process. Not even midstream, late stream. So that's probably the right thing that's happened. Make sure that our seniors are better, fully better, and really healed. We don't want them to be healed from COVID, but still be susceptible to other sort of illness. So that will make our active case numbers stay a little bit higher longer, but overall, for the benefit of the public health, that's a good thing. Related to cases, we've had 742 female and 544 males, 39 cases under 19, 212 in their 20s, 162 in their 30s, 169 in their 40s, 209 in their 50s, 180 in their 60s, 137 in their 70s, 116 in their 80s, and 62 in their 90s. 20% of our cases are under 30, 32% are under 40, 45% are under 50, 62% are under 60, and 38% are over 60 years of age. We'll break down the municipalities. City of Syracuse, 675 cases, 300 recoveries. Town of Clay, 107 cases, 76 recoveries. Onondaga, 90 cases, 28 recoveries. Manly has 62 cases, 44 recoveries. DeWitt, 59 cases, 37 recoveries. Salina, 55 cases, 36 recoveries. Cicero, 49 cases, 30 recoveries. Camillus, 42 cases, 33 recoveries. Geddes, 48 cases, 21 recoveries. Lysander, 29 cases, 20 recoveries. Pompey, 23 cases, 20 recoveries. Skaneateles, 15 cases, 13 recoveries. Van Buren, 10 cases, 4 recoveries. Marcellus, 5 cases, 4 recoveries. Atisco, 5 cases, 4 recoveries. Lafayette, 4 cases, 3 recoveries. Elbridge, 2 cases, 2 recoveries. Fabius, 2 cases, 2 recoveries. Spafford, 2 cases, 2 recoveries. Tully, 2 cases, 2 recoveries. Related to gaps in the investigation, get ready, get your pencils out on this one. Positive COVID-19 shopper who was busy shopping. So this individual on the following days, and it looks like they're all over the same weekend, pretty much, went shopping at all these locations. And so please bear with me on this. If you were at Mavis Muffler at 404 Oswego Street in Liverpool, Saturday, May 2nd, from 11 to 11:30 a.m. and 5:30 to 6 p.m., please be very cognizant of your conditions and certainly consult your doctor if you have any symptoms. If you were at the Walmart, 6438 Basil Row in East Syracuse, Saturday, May 2nd, from 1:30 to 2, there was a shopper in that building at the same time who was COVID positive. That does not mean you had direct contact, but again, we need to be cognizant of our symptoms. If you have any questions, contact your doctor. If you were at the Tractor Supply Company, 6641 Manlius Center Road in East Syracuse, Saturday, May 2nd, 2:30 to 3 p.m., again, you had a shopper in the building who tested positive for COVID-19. Please watch your symptoms. If now we're on Sunday, May 3rd. If you were at the PetSmart, 3865 Route 31 in Liverpool, Sunday, May 3rd, from 1:15 to 1:30, please watch your symptoms. There was a shopper who tested positive for COVID-19. If you were at Lowe's on 3856 Route 31 in Liverpool, Sunday, May 3rd, 2:30 to 2:45, someone was also at Lowe's who tested positive for COVID-19. Please watch your symptoms. Any questions, contact your doctor. On Sunday, if you were at the Aldi's, 3942 Route 31 in Clay, from 3 to 3:20, again, same deal. There was a shopper in Aldi's who tested positive for COVID-19. Please contact your doctor, watch your symptoms if you have any questions. If you were at Peppino's Pizza, 1849 Grant Boulevard in Syracuse, Monday, May 4th, from 1:20 to 1:30 p.m., same thing. Someone went to Peppino's, assuming they got lunch. They had COVID-19. Please be cognizant of your symptoms. And if you have symptoms or have questions, contact your doctor. And if you were at the Wegmans on 4979 West Taft Road in Liverpool, Monday, May 4th, from 6 to 6:30 p.m., again, same thing. Somebody was in the building shopping. Watch your symptoms. If you have symptoms, contact your doctor. Here's the good news. The individual was wearing a mask at each and every one of those locations. So this was one individual. And this just shows you how complicated tracing is, and certainly how the margin of error is still a challenge in our fight versus the virus. You could have one individual who was running their errands because they were probably working all week, running their errands, and this is what a regular weekend looks like for most families at different times. Maybe not as many stops, but many on weekends. They're just living life, and there's still that level of risk moving forward. So what do? We wear our mask, and we physical distance, and that helps mitigate the exposure to the virus. Again, certainly related to restart, we know one of the conditions for restart is tracers. We now have 300 county employees that will be trained via Johns Hopkins University for tracing, and certainly for all of you who didn't know this, I know you all probably knew this, but Dr. Gupta is a graduate of Johns Hopkins University. So she has extensive contacts there. So that's going to happen, 300. That's a big number. Why is that a big number? We're beefing up for the event that we may do shared service arrangements with other central New York regions. That 300 number satisfies not just Onondaga County's goal for restart, but the whole region's goal, satisfies and exceeds. So that is certainly ready to go. We continue to have discussions. The governor's put out some broad concepts about what different phases will look like. There's still more details to fill in there. We're still having conversations on that, but certainly our region is poised for a restart, and will certainly continue to advocate for regulation relief for businesses that are operating now that can do it safely. Example, some of the surgery centers aren't yet open for elective surgeries. We believe they should be, and we'll continue to make those. We'll continue to advocate for things where when people can do their job, physical distance, have the proper PPE, do things safely, and that's how we get going. That's what Restart Phase 1 really is loosening up regulations, maybe adding on some new businesses that weren't operating. This allows us to test the virus every time a regulation's loosened up, because you get more people back into flow. You get more contact. So that's actually helpful to us from the public health standpoint. We'll go over a couple lines, then we'll take some questions. Upstate Triage Hotline, again, you're going to call this if you have symptoms, you need to get screened for a test of COVID-19 at the Syracuse Community Health Center, 315-464-3979. If you don't have a doctor or don't have health insurance, you're also going to call this line. So please do. We've had thousands of calls to the line. I thank our partners at Upstate. Seniors, healthcare workers, and adult nutrition line, 315-218-1987. Again, this is a line we implemented in the beginning to help fill gaps for vulnerable citizens that are put in a vulnerable position when they normally weren't. So certainly our sweet spot with this is meals, some groceries. We've been doing different things as well with this. If people need help, that's one line you can get us. You can always call our office too if you need help as well. Child Care Solutions, our continuity of care plan, which has helped really keep our frontline workers and essential employees working, and certainly our child care workforce has just been absolutely tremendous. Our program through the month of May is free. So if you have a gap in child care, as you get brought back for a restart, call this number, 315-446-1220. We'll help you. And again, every day we're going to talk about it. So, we need to talk about it and recognize mental health is a serious challenge in our community right now, and will be a public health challenge moving forward. That's part of what this virus has done to us. We've had to change the way we live life. We've been separated from those that we love and not been able to see them. It's very hard. And so if you need help, 211 for social and emotional support. Questions?
The whole point of your voluntary shelter in place was to educate people that they need to better plan their trips out. So to have a person go to 8 places, Walmart, Aldi, Wegmans, seem awfully duplicative. Is this an example of what not to do?
If they did it all in one day, I think it would have been hard to hit that many stores in one day. But certainly, you understand how it happens. That's the way, that was the old norm, right? That's what we could do. We could shop at one spot, maybe get a couple things, go to another store, and hopefully we'll get that back. But certainly, you can see how complicated this one case is now for my health department, and now the community at large. How many people are going back and saying, geez, I was at that store. When was I there? Let me go find a receipt. So that's the margin of error that we talk about. And what's wrong with going shopping? Nothing. Nothing's wrong with it. But we're in this situation where it's much more complicated now. And so, yeah, that's one case. This is kind of an extreme situation where you had the individual do a lot of shopping. The individual was wearing a mask. We're very happy about that. And so, but it shows you how complicated, how that one case, the tracing, how complicated it can be, and how one case can take up a lot of infrastructure.
But haven't we been educated to plan our trips and not do this? Would you tell people this weekend, go to one place, get what you need, and then go back home?
Certainly, the more we're in places of public, there's more risk. And to your point, Andrew, I think the community gets it for the most part. That's why we've stabilized community spread numbers, not because we've done something magnificent out of my office. It's because the community has bought into this. But again, this is an example of what can happen and something that we should learn about. And there's things that can happen, gatherings that, you have gatherings and you get contact cases, right? So if we're going to have gatherings on Mother's Day, the law says you can't have more than 10 people together. It's the governor's order. But you need to be 6 feet apart, and you need to wear a mask if you're not. And even if you do that, there's a level of risk. You're increasing probability that if somebody is carrying this, whether it's light symptoms, it's dormant, it's asymptomatic, that's there. So this is tough. We have to learn how to live with it. That's where we are now. We're learning how to live with it. Our concern is that when you have these whether it's, we went through Easter, we went through Passover, now we got Mother's Day. So, these are all events that traditionally we get together and we celebrate the sacrifice and the joy of that. And you can't, so now you have your new norm. How do you still do that in a way that mitigates this risk to yourself and your family? And so it's a challenge. Hopefully, as we continue to progress, these types of events on our calendars that we all celebrate, the virus won't be as prevalent in our community.
About a month ago, you gave people guidance when it came to celebrating Easter or Passover. What would your guidance be for this weekend when it comes to Mother's Day?
Yeah, look at first off, we talked about, let's honor our moms. And for any spouses or significant others, two moms, even though they're not your mom, you need to honor them and do a good job. That's some advice, some friendly advice. But at the same time, let's just do it in a smart, safe way. And I can only tell you what we're doing. We will drop off a card and a gift to my mom. Will we be hanging out in our house like we normally do, or their house, where I grew up? No. They'll be on the porch, and we'll be 6 feet away. That's what we're going to do. Everybody knows enough about this virus now to make their own decisions. But that's what I'm doing. And so within my own family, again, it's a little different, right? My wife is with me every day. My kids, we're a team. If one of us gets this thing, we're all out. We're all in a quarantine. So that's a little different than if you're going to go and celebrate with relatives that you're not with every day on this. So that's what we're doing, and that's just an example I'll give. I have faith and confidence that everybody knows enough about the virus now, and they can take responsibility for their own situations.
Ryan, these 300 tracers who are going to be trained, those are all Onondaga County employees? And does that mean Onondaga County will be doing tracing for the 5-county region?
We may. We're talking with some of these other counties now about what that would look like. What it would probably look like if we do that is that there's a team leader in all these tracers. The team leader would be from one of the other counties, and then we would have people doing tracing under their guideline with their public health commissioner. But we're looking at this as a shared service opportunity to help some of these counties immediately as they do more proactive testing if their infrastructure isn't built up. Yes, those will be county employees. We have had some really qualified folks who have retired, who used to be in this space, reach out to us willing to be trained as well. So we have those names, and we're certainly looking at those in the event that we want to get them trained as well.
So that's close to 10% of the full-time workforce, right?
Yep. Yeah, I mean, over 3,500 people, so yeah, 300, yeah.
And the training happens when? It's a distance learning kind of setup?
Correct. It's a 4-6 hour course that everybody will take in the next week.
This weekend, 2 fair favorites are going to be joining Pizza Free there at the fairgrounds. Is there any concern over wine slushies being there and, kind of waiting in your car? I don't know if there's going to be police enforcement there or anything like that.
I'm not quite sure if we gave out a health permit for the wine slushie. I read about that. I don't know if we did. I do have concerns about giving out wine slushies and having people turn around and driving. Absolutely. The Pizza Free has been a wild success. We've talked about, I believe, how yummy it is. But these other businesses is giving everybody essentially a nostalgic opportunity of what the fair represents, and gives these business owners the ability to generate some revenue. So we think you can do it. We're watching these folks from a health standpoint, make sure they're doing what they need to do. The rules, everybody knows about it. So these business owners, the margin of error for them not being reported is 0. If they make one step the wrong way, we'll get an email, we'll get a picture from a cell phone about it. So So from a regulatory standpoint, we're very aware, but I'm not sure whatever the story was about with the wine slushies, if that's actually happening or not. But yeah, do I have concerns about putting alcohol from that venue into even if it's in a growler, in a car? Yeah. I know that they do it at bars right now and takeout. They do some of these things. I'm not sure how that works. Bars, you're off a liquor license. I'm not sure how that works with this. So, but yeah, that would be concerning.
Today was the first day you reported deaths, hospital numbers versus nursing home numbers. Is there now a permanent change to the way deaths are being reported to Onondaga County and how you're reporting them to the public?
Yeah, so we'll go to the state's website every day. That's how we're learning. So you can learn at the same time we do. And then we learn through our hospitals about anyone that passed in the hospital. And so we receive that information. So you'll get those numbers every day now. And certainly we're going to pray for the best, but the reality is that we're going to have tough days to come, just looking at who's getting sick. And so we just need to be prepared for that.
Can you elaborate on the confusion that you talked about yesterday, the not knowing of the nursing home data? I mean, people die in nursing homes regularly before COVID-19. Is that information supposed to go to the county health department to begin with, or because it's a state jurisdiction, it goes to the state? But if there was no reporting of any death in a nursing home, then we should have known all along people were dying and it not being in that grand total.
There is no reporting to the health department on that. That's just, nursing homes have to report that to the state health department. That's how that works. That's the old way of doing business pre-pandemic. That's what was being done. Now you're in week 8 of a pandemic. This impacted our community in week 5 in nursing homes, maybe week 6. It wasn't a problem before. We didn't have cases in the beginning. So you now need to do things differently. The nursing homes essentially have this infection there, which is challenging their infrastructure. Now they're willing to ask for our help and use our resources and our ability to help get things done for them, still being the fact that their regulatory agency is still the state of New York.
But should anyone at the county have thought, let me check on state health department numbers because someone must have died in a nursing home?
We weren't getting answers.
Do you have any more information on when the 19 that you reported yesterday, like over what time period those happened?
We have no information other than the number. We don't know who they were, when they passed. Only reason I know about one of the 2 today was because the relative reached out to me. So, or else I wouldn't know anything about that.
So your total number now is numbers you get directly from hospitals and nursing home deaths that you get from the state.
Correct.
Because the state now, even right now, has the total number of 48 deaths for Onondaga County on the website.
I don't understand where they get their numbers from.
Yesterday you said you might have more information on an Onondaga County resident or how Onondaga County might be connected to Green Empire Farms in Madison County. Do you have any more information?
We have some positive cases from that. There might be some pending tests related to county residents. So as soon as we have all those back, I'll give a total number related to that. It's been well reported on. So as soon as we have the total number, the health department's going to give me that number, and I'll share that number. Tim, again, to your question, to your point about the numbers, I want those numbers to be our total numbers. They're just not. So I don't know how they're reporting. If I'm wrong, again, that will be the happiest retraction I've had as county executive.
Are you still concerned about getting your arms around all the testing that's being done in Onondaga County so that you can get the number of tests being given? We had some urgent cares come on this week.
Yeah.
Is that still important, or can you?
It is important, and it's important for our tracing, because part of tracing, your strategy is gonna change a little bit. You're probably gonna need to trace symptomatics, people who get tested with symptoms even before the positive a little bit. That process will need to start a little bit earlier due to all the testing. So it is still important. We need to communicate. To be a well-oiled tracing machine, we need to have everybody doing testing, working with us. And really, this is diagnostic testing, the antibody testing. We're not going to take as seriously. And you could get a lot of false negatives, false positives. The story that tells you is a broad story. Can't tell you if you're really immune or not. So we're talking about the diagnostic swab testing when we do that. But certainly, if we don't have some of these facilities, and again, I get the rush to test, but if we have every pharmacy doing this is A, it's unnecessary, but B, it really waters down our ability to trace the way we want to trace.
Because you don't want to give up the 2 or 3 days that you're waiting for results.
Yeah. And if you're doing, and look at when you got to do proactive testing, you want to do it in a way where you're eliminating and identifying potential risk. So if you're doing just this random testing, random proactive testing, I guess from a statistical standpoint, there's value there, but we want to be surgical with it to eliminate risk into communities that we know don't do well with the virus, and then continue to go back at that. So the more and more randomness you do of the testing, and at some point there's going to be random testing. This neighborhood had 8 cases in this 2-mile radius. We need to do some proactive testing. Let's go there, right? But we've done a pretty good job controlling this and flattening the curve. That's why we can talk about restart. That's why we're going to restart when we do. To change up the system, you have to pivot in the system. The testing doesn't help. It doesn't help. I'd rather have less testing locations, more testing, all within a strategic way to help our health department collect data that is meaningful, where we can then make decisions. Where you had them was where you're finding asymptomatics and light symptoms in the buildings that had COVID cases. The majority of what we're seeing with these numbers are related to the nursing home, where we know it gets into these buildings and it just spreads. And so our assumption's going to be, and it will prove out over the next few weeks as we continue to test other independent living facilities that we haven't found COVID yet, that we probably aren't going to find it. Or if we find it, it'll be very limited and spread. But we're going to go, when we start doing proactive testing in neighborhoods, we're going to be picking neighborhoods that have seen cases. Maybe not a spread, but have seen cases. We would anticipate we would see similar results in those neighborhoods to what we saw in the assisted living facilities that had a couple cases early on, that will find more asymptomatic people, more people that have light symptoms that wouldn't have gotten testing.
And does that just show you that once it's in a building or a neighborhood, it gets around, but if it's not there and you're protected, you're safe from it?
Yeah, I think density is really, and everybody wants to look, about how this impacts neighborhoods of poverty, and it does, because there's more density in those neighborhoods. Even when you get a positive case, the ability to socially distance to avoid contacts is very difficult, very difficult. And so I know there's not as many people in Fabius and Tully and Lafayette. I also know the space between properties and the ability to socialize outside of a scheduled event is not as great. And look at their numbers. Very, very small. So when you have density, when people can go out in their front yard and hang out, or go out on the front porch in a 2-family and run into other people, there's more opportunities for the virus to really feed and attack, and that's what we're seeing. So that's going to be, that's a kind of what we're seeing now at this point with contacts. These contacts are coming with family situations where the ability to spread themselves out and truly isolate isn't, the real estate doesn't allow them to do that, essentially. And anybody that gets COVID positive, we offer to put them in a hotel. But if you're a parent and you need to watch your kids, how's that going to work? You can't. So that doesn't work for every case. So density drives the contacts. Density drives the positives. And so it's really proactive testing needs to be about the density and finding those cases and isolating them as fast as you can.
I know you touched on this yesterday, but we've had a bunch of calls from the community wondering why the county wouldn't go to the fairgrounds where there's going to be thousands of people and test them there. And I know you just talked about strategic testing. Does that kind of play into it?
Yeah. Well, how do you register them? Everybody we're going to test has to be registered. We have to know who you are, or else we get a positive. Oh, we don't know. So that's part of it. How do we register people when, Grazi at Pizza Freet's not registering him to come get Pizza Freet? If he wants to put in a registration system, we'd be happy to maybe team up with him and buy your Pizza Freet and get your COVID test at the same time, right? That's a new thing, right? But that's the key. We have to know who you are if we're going to test you, so that if you have it, we get you in isolation and we quarantine everybody you contacted with. So again, randomness doesn't. If we want to just get numbers, we test anybody. We don't care. I need numbers. I ask you to get tested 20 times, and I give you a different name every time, right? That's the wild, wild west of testing. We are doing testing, which costs money and resources to get results and make informed decisions to stop the spread of infection.
Did you say that there's one large nursing facility that's going to take all the COVID patients?
Yeah, we've worked with there's COVID floors on multiple facilities. Some of them have more capacity than others, and we're now working out a plan with one specific facility to expand their COVID unit to take and really help out, and we're very, very appreciative of that.
Which facility is that?
I believe it's the Bishops.
I know you're concerned with the age demographics before of them getting skewed a little bit older, but now 20s is the decade with the most cases.
Yeah.
Which it's been for a few days. Do you read
Well, they had a good run in the beginning too, where they were dominating the cases. I saw that. I think that number's jumped over the last few days. So I don't know how many people are in their 20s in the room. Maybe you can tell me why that's happening. And my theories, but more active generation, more socially active. Probably a lot of folks in their 20s still in the workplace. I don't have the early narratives about travel and whatnot made a lot of sense. That's not happening now. So my assumption, remember we talked about last Saturday and Sunday, and maybe there's a correlation there. You have a 3 to 5 day incubation period with the virus. You go get tested. 24, 36 hours later, you get it. You're positive. Today's Friday, so the timeline would fit if we had a big jump in one day. It looks like we had a jump in one day. I don't know if that was under 200 yesterday or not. I don't remember.
I've been at a lot of the briefings here, and I'm wondering, since the first week, has this been your toughest week? Yeah.
Yesterday was unexpected. It was a bad day. Today's a bad day. Essentially, when you look at the loss of life, we're going to have these. That's part of the process, and it doesn't. You learn every step of the way about this. It used to be you get really high and low based off of number of cases, but you learn, and the reality that there's going to be cases, especially when you're doing this level of testing. You accept that, but now we're at the point with this that we're in week 2 to week 3 of who the cases are and who's gotten sick. And the reality is these are the people that could least afford to get this virus, and that's why we're losing so many of them. And so that's not going to change. And so we're going to have more days like this where even though we're getting through the process to restart, and we're restarting our economy, that's going to help with the mental health of the community, the economic ruin. But the reality is we're still going to lose people, and that's very painful. Any other questions? Today is Child Care Provider Appreciation Day. We couldn't do what we're doing without our child care providers. Really underappreciated throughout time, no longer underappreciated today. We've recognized our teachers and our nurses, and now our child care providers all 1 week. This all happened this week. It's pretty ironic considering what we're facing in this pandemic, that these are 3 professions of frontline heroes. And these providers remained open to really help keep our infrastructure intact to get us to where we are today. So I just want to thank them all so much for what they did. Specifically, I want to thank Child Care Solutions and their provider network, who have been a tremendous partner. And certainly I want to thank Sharon, who takes care of Officer Andrew McMahon every day. As without Sharon, I don't know what we would do. And I just want to let everybody know, this is some feedback we received from one of our COVID neighbors who recovered. Ed certainly called our office today. He recovered from the virus, was released from isolation, and he wanted to personally tell me how wonderful our health department is, particularly Laura. I don't know Laura's last name, but I'll have to find out. So good job, Laura. And how much she helped him when he was sick. Meals were provided to him, counseling helped guide him. And I want to thank Ed for his kind words, and happy that he's recovered and he's starting to get his life back to normal, as we all will. And certainly we'll learn from all of this. And at the end of this, we're going to restart. We'll beat this virus, and then economic recovery, and we'll be stronger. So certainly, again, we'll give a briefing tomorrow. Then we're going to take Mother's Day off, and certainly thank everybody again, and please be safe.
Do you have a Mother's Day message for Kate McMahon?
Well, Andrew, I got to think through that message. I got to be right on the money on that message. All right.